Go into some more. Brian calling from Missouri on line 5. Brian, welcome to the show. Happy Quarantine Friday.
Hi, yeah, same to you. Good to finally talk to you. So I'm in Southwest Missouri here, a bigger city down in Southwest Missouri, if you call it a bigger city down here. But I have intimate knowledge of both of the health systems here in town. I'm in the emergency services business. My wife is a nurse. Coworker of mine is a nurse at the other hospital. Both nurses this week have been sent home because there's nothing to do. They don't have the patients. The EMS system has dropped about 50% in call volume, and the hospitals are just hanging out. So my point to that is balance. We're not New York City, and you can't use the same tactics that they're using in New York City for Southern Missouri.
Right.
It's just a different world, a different area. And yet we are Greene County, so Governor Parsons has not locked the state down, at least yet. But our county has, and so the county has gone into lockdown. And so we have all of these people. I have friends that have small businesses. Nobody can get out and work, but yet our hospitals were sending nurses home because there's just no need for them.
Right. That is a huge point
very,
that you just made. And we were mentioning that too. This was something that Cuomo had mentioned. And for those who are listening, caller Brian from Missouri is talking about it, works in healthcare, telling us about the lay of the land there. Because New York, I mean, obviously everybody knows Southern Missouri, and Brian, you can attest to this. People don't live on top of each other in Southern Missouri. You know, you're not living in a building with a frillion other people. You know, there's wide open spaces. So it's different. I mean, it's actually easier to distance and to sort of practice that. You can't use the New York City approach to, you know, for Joplin, Missouri, or for Springfield, Missouri, or for Poplar Bluff, Missouri. You can't do that. You just, it's just not going to happen. And what? Let me ask you, Brian. What are people in your area? What do they kind of think about all this stuff? I mean, do they feel as though it's good to be cautious, but do they feel that it's an overreaction?
Yes, that is heavily the thought process around here right now, is that everything is like that. So it's amazing how people, when this type of thing happens, by some of my conservative friends, it's amazing how many of them want the government to shut things down.
Yeah.
They're asking, Governor Parsons, shut this down. Why aren't you doing it? And I'm amazed. Why? I can be an adult myself, and I can keep my family home if I'm concerned. My grandma is fragile. She's in a nursing home. We haven't gone to see her.
Right.
We've told her, just stay there. Just ride this out.
Right.
We'll call you. We'll check on you.
Right. Yeah.
She's fragile.
Yeah, see, I get that. You can't do that top down. I got to get going, unfortunately. But, Brian, I appreciate you calling in with that. And I think that's a huge point